Hi everyone. So I will get started now. I just want everyone to let everyone know that this event will be recorded and live streamed on the SCHC YouTube channel. So I'll just give everyone a few seconds to turn off your camera if you would like to, or change your display name or anything. And also, I wanted to let everyone know that we do have Tamil, Urdu, and Hindi interpretation available. To access this, please find the interpretation button at the bottom panel of the Zoom call. So it should be towards closer to the right side. And once you click on this, you'll be able to choose what language you would like. Okay, so I'll just get started now. Thank you to our guests and panelists for taking the time out of your evening to come out here. Just a housekeeping reminder to please keep your microphones muted during the event. We will have a question and answer period at the end where you will have the opportunity to speak to panelists if you wish to. But until then, please put any questions that you may have in the chat box. Just to introduce myself, my name is Vinofa, and I will be your moderator for the evening. Before we begin, I would just like to acknowledge that the land this event is taking place on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now also home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that Toronto is covered by Treaty 13 signed with the Mississaugas of the Credit and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. We hope that you'll find today's session helpful. To start us off, I want to welcome Kishana Antrobus and Jem Munir, who are both outreach workers with SCHC's COVID Equity Action Plan.
Hi.
Hi. I'll get started. I'll direct my first question to Kishana. So what exactly is the COVID Equity Action Plan?
So it's funded by the City of Toronto and the Ministry of Health. It focuses on the health areas and highest incident of COVID-19. It prevents the spread of COVID-19 and it provides support to those who are tested positive.
Thank you. So the next question I'll pass on to Jem. What services exactly does the COVID Equity Action Plan provide? Sorry, Jem, you're muted.
Thanks, Jennifer. We are providing a number of services to our population, which is south of Scarborough. We are providing them free hand sanitizers, free masks, and also helping them to access testing sites in Scarborough and how to stay safe at their homes. And we are also giving them information, voluntary isolation centers, and if they want to stay at their homes. We are also providing them about our own wraparound services for those who test positive. And also we are providing them access to COVID vaccination center. There are a number of vaccination centers in Scarborough, and we are helping and providing them information that where are these centers so they can go and they get vaccine from these centers.
So I'll pass my next question back to Kishana. What exactly do you mean by wraparound supports?
So if a person's tested positive, they can receive supports while they're isolated in their home, including information on how to isolate in their home, access to masks and hand sanitizers, food, income supports, and access to other SCHC programs.
Thank you. So the next question I'll pass back to Jem. What other agencies are doing this work in Scarborough?
There are 3 organizations working in Scarborough. South of Scarborough, there is only one organization, that is SCSC, that I'm representing, Scarborough Centre for Healthy Communities, the full name. And north of Scarborough, there are 2 organizations, Malvern Family Resource Center and the Thaibo Community Center.
So back to Kishana, to access these services, does a doctor have to refer you or?
No. Anyone can refer to the program, including self-referral.
And the next question back to Jem. Can I get someone to come talk to my church or group?
Yes, Minifa, this is a very important question and burning question as well. We are flexible. We can talk to anybody, any faith-based group or any organization. Let me tell you one thing. We have already contacted um, um, Muslim community and two imam of a mosque in Scarborough, and my other colleague, they're also contacting other faith-based organizations. Yeah, we are pretty flexible for that.
Thank you. So the next question, back to Kashana. Do you have to go to an isolation site if you test positive and the rest of your family is negative?
No. So you don't have to go to the voluntary isolation centers, but it is available if you feel you cannot isolate safely at your house.
Thank you. And this is to both of you or either of you. Have you had the vaccine? And if yes, which one did you get and what was it like?
I had my first dose that was around 2 months ago, and I will say, everybody, I will advise everybody, if they have any chance, if their number or time comes, they should go for vaccination center. They should get vaccine without any hesitation. There is, to be honest, there is no side effect. It's going to take only 1 hour. And because 1 hour, I'm saying because there are long queue, you have to wait for that in order to get your vaccine. Otherwise, it's only 2 minutes, and you have a little bit pain. Even you can feel that you can't feel that pain in your arms, whether it can be right arm or left arm. Just otherwise, you're safe, and you can come back safely at your home. If you are getting this vaccine, you're saving the whole world. You're saving yourself, your family, your community, your friends, and everybody. I will encourage everybody. Please go ahead, with this vaccination. Thank you.
Thank you, Kashana and Jen. So next, for our next section, I would like to welcome Michael and Hazley to speak on their own vaccination experiences. So Michael moved to Canada 20 years ago for a school in London, Ontario, and is now made Canada his home. He lives in Scarborough and is married with 2 boys, ages 3 and 11 months. One son was exposed to COVID in daycare, and his wife's family in Toronto also got COVID a month ago and have fortunately since recovered. Halsey Crawford, won an Olympic gold medal in the men's 100-meter race at the Montreal Olympics and also earned Trinidad their first Olympic gold medal. He has also won several accolades, such as the highest national award in Trinidad and Tobago, which is the Trinity Cross. So hi, Michael. I'll start off by asking you, have you had the vaccine and which kind? Also, how was the experience?
Thanks, Vinofer. I did get the vaccine. I got the first dose last Thursday, and I got it at the hub hosted by the Scarborough Centre for Healthy Communities. It was just after the new priority postcodes had been started off, and I was able to log in, get an appointment, and come in. And the whole process took about an hour, and it was very smooth. I got there, I was screened, I was asked some screening questions. I was able to get on the queue. I was able to register, waited for 5 minutes, got my vaccine, and then waited for another 10 minutes just to make sure that there were no side effects. And that was it. My arm was just a little bit sore. And besides that, everything's been great. And I'm just happy that I'm able to actually
use the polymerase enzyme inside the cytoplasm to produce a protein that looks like the spike protein of the virus. When those proteins released out from the cell, our immune system will recognize them and will produce antibody against them and will produce other kind of immunity too. So if someone gets exposed to the COVID vaccine after that, the immune system recognize those spike protein, will fight them, will kill them before that person develop infection. DNA, it's a double strand. It's double strand sequence of nucleotide. It's more stable, so that's why The AstraZeneca is being given through the family doctors and pharmacy because it's more stable in storage and transportation than the mRNA. It's a defective virus, so it goes inside the nucleus, but it does not go inside the human genome. From those DNA, from that DNA, mRNA will be made, and that mRNA again will produce the spike protein-like protein. Once released, the immune system will recognize them, will fight them, and will produce antibody against them. So this is that are approved by Health Canada. 3 are available. Johnson & Johnson should be available by the end of April.
Thank you. So the next question I'll pass to Dr. Ahmed. How effective are these vaccines, and what is the point of getting a vaccine if it doesn't provide 100% protection?
A very good question. These vaccines are highly effective. When we say it's highly effective, you might probably heard that some percentage, some numbers on social media, on TV, 60, 70, 90, 95%. That's not the end point. The end point is, are these vaccines prevent hospitalization, severe disease, death related to COVID? Yes. When we consider these numbers, they are 100% effective. We have seen the effectiveness in so many different levels. Look at our nursing home. What happened during the first and the second wave? Our nursing homes were in a very bad shape. How about right now? We don't even hear any deaths from the nursing home because the Ontario government and the Canadian government and other provinces as well, they targeted long-term care in nursing homes and seniors over the age of 80, and they provided these vaccines early on, and that's how we have some sort of stability in long-term care. And this shows that they are highly effective. We can take Israel, we can take UK. We know what happened to those countries. Look at them right now. Because of their success in the vaccine administration, they are opening up. In Israel, things are almost back to normal in every aspect. And UK, they are opening up and they are in a better position than any other European countries. And we want to get there. We want to get there. Now, in vaccine administration, US, you have seen what happened with US. There was a lot of devastation, lots of lives lost. Over 500,000 people died of COVID vaccine. It's a very unfortunate scenario, but right now their vaccine administration is way ahead of a lot of countries in the world. They vaccinated at least over 50% of their adult population at this moment. And they're gonna open up very soon. They're gonna open up very soon. These vaccines are highly effective. We have to see the end point. The end point, all vaccines prevent severe illness, hospitalization, and death. And I want to mention one point. When
100% effective against hospitalization, severe infection, and death. There's a little bit of variance between the effectiveness against mild infection, but you should take whatever available to prevent severe infection, hospitalization, and death. We have seen in the third wave, more young people got infection, that they require high flow oxygen intubation. Our hospitals in Scarborough are full, and we transfer patients every day to Kingston, Belleville, Campbellford, Lindsay, Peterborough, and those hospitals are full now, and we start to transfer patients to Ottawa now. So maybe in the near future, I mean, hopefully the third wave doesn't get more worse, but if it gets more worse, I think we may need to transfer patients further than Ottawa now. So that's the effectiveness of the vaccine. Against variant, there is no really studies done against variant, but I'm sure they will develop some immunity against them. A media release from Pfizer showed that their vaccine 100% effective against South African variant. there was 800 people enrolled in South Africa, and the effectiveness was 100%. We don't know the exact effectiveness against the Brazilian variant, but I'm sure it will be 100% effective against severe infection and death. The vaccination companies, they're doing studies to changing a little bit of the recipe to target those variant, but there is nothing available yet. The other good news that Pfizer also Pfizer vaccine showed effectiveness 100% for the age group between 12 to 15. They're gonna submit it to the FDA, and hopefully after that, Health Canada will approve it, and we will have a vaccine available for younger than 16. Right now, in our lab, about 90% of 18, to be exact, 89% of the COVID is the B117, which is UK variant. And out of those, I think 5% are Brazilian, which is P1, or South African B1351. Okay.
Thank you. So the next question I'll pass back to Dr. Ahmed. Are there any side effects to any of the vaccines, and how long will I have the side effects?
Yeah, this is also another valid concerning question. Yes, a lot of people are concerned about side effects, especially with the information and misinformation and fake news that's going on in the social media. A lot of people are worried about their fertility and a change in their genetic makeup and effect to their DNA. Yes, this is an RNA vaccine, but things, once you the vaccine goes into your cell, consider your cell as this room, and your DNA is locked in a safe place called a nucleus. And the messenger RNA does not have any interaction with your DNA. It does not affect or change who you are or your fertility. And there are some minor side effects, like having some swellness and some pain at the injection site. Some people might experience some headache, fatigue, and even low-grade fever and muscle ache. What my experience, and a lot of people experienced, I had the mRNA vaccine. I experienced some pain at the injection site for 2 days, but it did not prevent me from doing my routine activities, including exercise and work, and doing my other daily chores at home or in the community. Some people experience more symptoms during this second shot. I haven't had it, but everyone I have seen and my patients did not have any significant illness to cause concern. The only issue that we will discuss about some allergies. Yes, some people who have significant allergy to the vaccine during the first shot, those people should not get it the second shot, and they need to see an allergist or immunologist for further management. Otherwise, it's highly effective and well tolerated with very, very mild local symptoms.
The vaccines are halal because they don't have any animal product, and because tomorrow is the first day of Ramadan. If you take the vaccine during the daytime, it does not break your fast. So all Muslim countries, like they all announced that the vaccine does not break the fast. You can take it in the day and should be okay. Thank you.
Just to add one additional resource on this, I was surprised. There are lots of good people in the community to support the community. There is Canadian Muslim COVID Task Force. It was started or initiated by Canadian Muslim Doctors Association, as well as Canadian Muslim Islamic Council of Imams. Sorry. So they have a lot of a discussion on this, and they have extensive resources, and they declared this is a halal vaccine. And they have other resources related to COVID and COVID vaccine, and it's called Canadian Muslim COVID Task Force. You can Google it and you can access it. We
Thank you so much. So the next question I'll pass back to Dr. Ahmed. Do I need to get the vaccine if I've already had COVID or if I have COVID right now?
This is another good, a great COVID vaccine because at this time we don't know the strengths of our immunity.
Whatever available for you, take it without hesitation, because we don't want to go to the fourth wave. If we don't develop the herd immunity, we will end up in fourth wave and fifth wave. And unfortunately, some of them died because of the infection. So I think whatever available now for you, you should take it. They're all effective against severe infection and death. Thank you.
Thank you. So the next question I'll pass back to Dr. Badri. Can I get a different vaccine for each dose? For example, Moderna for the first and Pfizer for the second.
At this time, all vaccines approved by Health Canada are considered highly effective, and we have seen the effectiveness in the community. They are highly effective, and we should go get whichever vaccine is available, and it's highly protective. However, at this time, these vaccines are not interchangeable. At the same time, there are some studies going on currently to investigate if someone gets Pfizer, can that person get Moderna or AstraZeneca, or the other way around? And that we might probably get more information in a few months or in the future. But at this time, they are not interchangeable.
Thank you. So back to Dr. Balhaj. Again, you did touch on this, but why is the AstraZeneca vaccine only for 55 and older? Should I not get this vaccine?
Yeah, so AstraZeneca vaccine, it's been developed in England. It's been widely used in England with Pfizer. And as Dr. Ahmed said, I believe more than 50 million received at least one dose in UK, and they don't have the third wave now because of the effectiveness of Pfizer and Moderna and AstraZeneca vaccine. There is a small risk that it may cause a blood clot, and it's been noticed in people who are younger than 55. And in my review, I found that the risk of getting blood clot from birth control pills, it's more than the risk of getting blood clot from AstraZeneca. It's very, very, very uncommon. And as I mentioned, our premier, as an example, and the Minister of Health, both of them, they got the AstraZeneca vaccine. So it's effective, it's safe, and as Dr. Ahmed said, all the vaccines go through extensive
experience, really good. And the 3 to 4 months period is strongly suggested, and it's highly recommended, and especially where there is vaccination scarcity. And this is the only way out for all of us. And yeah, that's what's recommended at this time.
Thank you.
I just want to add to Dr. Ahmed's comment that there is actually a study done in the CDC with the mRNA for Pfizer and Moderna vaccine. And 2 weeks after the first shot, the effectiveness is about 80%. The effectiveness 2 weeks after the second shot is about 90%. And it's better to immunize, for example, 2 million with 80% effectiveness than to immunize 1 million with 90% effectiveness. So, and I'm sure if the vaccine become more available, the duration will become shorter. So and what I want to add that in UK, they are using 3 months interval between AstraZeneca and Pfizer, and they have like very effective vaccines there, and they don't have the third wave now. Thank you.
Thank you. So the last question we have here is, what is herd immunity and why is it so important? I'll pass that on to Dr. Balhaj.
Yes. So herd immunity means like everyone develop immunity against an infection. So the herd immunity comes by 2 ways: by natural infection, everyone get the infection, and they will have immunity, and the infection will go away after that, or by giving or by getting vaccine, and everyone develop immunity, so they will not have infection. Unfortunately, with the natural infection, there is high risk of morbidity and mortality. But if you take the vaccine, there is no risk of morbidity and mortality. So that's and thanks God that the vaccine is available now, so you can take it. So if everyone should take it to develop herd immunity and preventing fourth wave and fifth wave and sixth wave. Otherwise, it will never end. Thank you.
Thank you. So now we'll move back to Halsey, who's going to speak on his own vaccination experience.
Come, Hazley.
Hi, welcome. So
hello, good afternoon.
Good afternoon. So the first question we have is just, how have you had the vaccine, and if so, which kind, and how was your experience?
AstraZeneca.
Yeah,
can you speak more on your experience?
More of your experience, Hazley. You want to know what more of your experience?
Oh, okay. I'm 70 years old. I'll be 71 in August. And I do suffer from diabetes and high blood pressure. So I decided I want to be protected. So last week, Thursday, I think. Tuesday, I made an appointment and I took the shot.
And it was an easy process.
Yes.
So what made you decide to get the vaccine?
You wanted the protection.
I wanted the protection because of my age, of course, and two diabetes and high blood pressure.
Is there anything else you would like the community to know, or anything else you want to share about your experience?
It was not painful. During the night, I had some minor pain in my joints because I do suffer from bursitis. The morning I had a slight headache, and after 2 days I was gone. No problem at all. No, not really. It's depending on what you want to ask me.
Dose, unless they have certain medical exceptions. So for example, if they have recently had an organ transplant, or certain kinds of cancer conditions, or they're on hemodialysis. So people with very specific high-risk medical conditions, they can get their second dose sooner. But for most people, it's a 16-week wait. So sorry for the long answer, but the eligibility requirements are quite complex. So I wanted to give you that detail, but please go to the website so you can see for yourself.
Thank you. So for the next question, do you have more information about the pop-up sites, of their locations, or?
Are working with a couple of groups right now. Quite a few of the MOS have approached us, and they have adequate space. We are also working with Community Services that services the Black community in Scarborough North. We are going to be having a pop-up clinic there in a week or two. And we'll just keep updating that list over time. We're also going to be looking at community centers and banquet halls that we can use to bring people to get closer to the community.
Thank you. So the next question we have is, are all vaccination sites getting access to the same vaccine formula?
There are some differences. Our clinics, we have access to Pfizer and Moderna. For the pop-ups, we may use Moderna because traditionally Moderna was just easier to transport in terms of the temperature that it needs to be kept at, etc. But we're learning more about Pfizer, and Pfizer is actually now a bit more portable than we originally thought, but we're using Pfizer and Moderna. If you go to a pharmacy, you'll get AstraZeneca. And if you go to a primary care physician, and there are a couple of primary care physicians that are giving the vaccine, they are also using AstraZeneca.
Thank you. So the last general question we have is, what do I need to get the vaccine? For example, money or a health card, etc.
You do not need to get the vaccine. Canadians do not have to pay for the vaccine. An Ontario health card is not needed, but we do need some form of identification and contact information because, as you know, this is a 2-dose vaccine. So in order to follow up with people to book, sometimes you get your second booking before you leave, but in order to follow up in case the date needs to change or the time needs to change for the second dose, we do need to have that information. So we do need some way of contacting people. And we do
Thank
need
you.
to know people, the name of the individual that is getting the vaccine.
Thank you, Michelle. So now we've come to our Q&A section. We'll first start going through any questions that may have come through the chat that are unanswered, and then we'll open the floor to any more questions or discussions that participants may have. Let's see. So it looks like a lot of people have questions regarding the pop-up clinics. And I know you've already spoke about that. Do you know if the provincial booking system or any online booking system will, I guess, have access to bookings for 18 plus at the time?
Not at this time. Not at this time. That may change in the future as we get more vaccine and we work our way through the age groups. But currently access for 18 plus is through pop-up clinics and mobile teams. So a mobile team, let me just, I know it's confusing. So a mobile team is a team that might come to a large apartment building or a supportive housing building. And they might even go door to door and give people their vaccine. So what we've decided is more efficient is that if you're at a building for the day or for a half day, you may as well do everyone in the building that wants the vaccine rather than go and do 50 plus 1 week and then come back next week and do 40 plus and then next week come and do 30. So that is an example of a mobile team where if you're 18 plus and you're in that environment, you live in that building with people who are older, that you can also get the vaccine. Also, sometimes, as I said, we might go to a shopping mall or a church or a temple and set up a clinic for a day. And we would invite people that from that church or from that neighborhood to come and get the vaccine. And again, that would be an opportunity for people over the age of 18 that are living in Scarborough to come and get their vaccine. So those are examples of mobile and pop-up clinics. But in order to come to book an appointment for the hospital or Centennial College, one of the larger clinics that's in a permanent arrangement, you have to be 50 plus at this point in time.
Thank you. So another question we have for either you, Michelle, or Dr. Ahmed.
And sorry, I see Jeannie has her hand up as well. Maybe she's able to or explain it better.
This goes to show how very confusing it is for even those of us who are working very closely. It's changing all the time. So at the SCHC hub location at Brimley and Eglinton, we did start a pilot projects and we have been doing 18 plus if you live in one of the hotspot communities in Scarborough. So it is the only current location that's a permanent location that has the okay to go ahead and run this pilot. So it's not also very clear, as you can see through the chat, that that's the case. But if you go ahead and book and pick that location, you will get an appointment, although we are fully booked for the next couple of weeks. New appointment times are opening up on a regular basis. So please be patient, bear with us, go back and check. We're planning on opening the clinic full-time hours or permanent hours starting on Saturday, which will be 7 days.
We want to vaccinate as much people as we can before we give the second shot. And as I mentioned before, it's better to vaccinate 6 million with 80% effectiveness than percent that at least required for herd immunity faster. Thank you.
Thank you. So one question we have here is, what vaccine is being offered at the SCHC hub site?
So we don't know from day to day. Up until this point, it has been either Pfizer or Moderna, but we can't let people know ahead of time. It depends on the availability and supply, but to this point, it's been either Pfizer or Moderna.
Thank you. So another
I
question.
I just want
sorry.
to add, reiterate what we have said earlier. It is very, very important that we should get a vaccine that's offered to us, what's available, and we should go ahead and get the available vaccine. That's the most important thing. All of the vaccines that we have shown to reduce, not only reduce, prevent severe disease, hospitalization, and death from COVID. These are the three end point of the vaccines that we are being provided at this time. And I think it's very important that we should get the available vaccine at this point.
Thank you. So another question we have here is, do I need to bring any proof if we are immunosuppressed or meet the high risk category?
Sorry, again, I couldn't hear the question.
Yeah, I heard that one. Yeah, people are asking if they need to bring proof of their medical condition. And I think initially there was a request for people to bring things like their medication list or something from their doctor, but it's not about whether or not you'll get the vaccine. I think it was more to understand the particular condition that people may have. So most of the hospitals in Toronto, we've talked about this and feel that an honor system is probably, you know, the best way to go, so that we don't turn away people if they don't have proof of their condition. But I think the more information, if you do have a serious medical condition and there is some information that you can provide, I think that would be helpful. But Jeannie, maybe you could speak to what you've been doing at SCHC.
I think you summarized it nicely, Michelle, is if folks do have a copy of a prescription or their medication they can bring, but it is really the honor system. And again, because we've been fortunate to open up the criteria, it's become less of an issue in terms of having to demonstrate or prove that you have a chronic condition. Where our aim is to get folks vaccinated and to do that as quickly, as effectively as we can. So at this point, we're really looking at the honor system. But again, most of the folks that are coming through the clinic qualify under a number of the eligibility criteria that we're able to honor at the Brimley and Eglinton location.
Thank you. So another question we have is, again, specifically for the Brimley and Eglinton location. It asks, are all Scarborough residents who are 18 and older eligible, or only those residents in the specific postal codes?
We have been accepting everyone in Scarborough, 18 plus.
Thank you. So another question we have here, are there any specific medications that interact poorly with the vaccine, for example, penicillin?
There's no interaction between the vaccine or any other medication. If you have any vaccine, if you got, for example, flu shot, or you got, for example, tetanus shot, you wait 2 weeks and then you get the COVID vaccine. And if you get the COVID vaccine, you wait 4 weeks to get, for example, tetanus shot or any other vaccine. But there is no interaction, no cross reaction. If you have allergy to penicillin, you are able to get the COVID vaccine. And staff in the assessment center, in the vaccination center, we did not have any severe allergic reaction, and we give 10,000s of vaccines through Scarborough Health Network. Thank you.
Thank you. So a question we have here is, are seniors with chronic care registered with LHIN able to get the vaccine at the interval of 21 to 28 days?
As Michelle said, so we follow the guidance from Ontario government. The only exception to go through the regular vaccination schedule if someone has organ transplant, or someone has hematological blood, or any other malignancy on chemotherapy. It has to be in chemotherapy and not.
So it would depend on the reason that they're on home care. It's not just people getting home care, but it depends on what the specific medical condition is.
Yeah, but I mean, those are the medical conditions that they got the vaccine in 3 or 4 weeks. But any other medical condition, they wait for the 4 months, and hopefully, as I mentioned before, if the vaccine more become like very available, most likely the government and the NACI will shorten the interval. And
yeah,
Pfizer for the second vaccine. If you got Moderna, it's Moderna. So the vaccine, it's not interchangeable. Thank you.
Another question we have here is, for caregivers of those who are high risk, are they eligible to be vaccinated even if they're not over 50?
Yes, if you're deemed to be an essential caregiver, then it's not based on age.
It looks like we don't have any new chat questions. So if anyone here right now would like to ask any questions, you can just raise your hand and I can unmute you to speak. So another question just came in. I've seen a lot of people booking online through the system using the eligible age groups option. This allows anyone to apply. So if they don't actually meet the criteria, will they be turned away?
Sorry, can you repeat the question, please?
Yeah, sorry. So I think they are asking, when you go to book online and you choose eligible age groups, it doesn't really ask for any proof. So if they show up and they don't actually meet the criteria, will they be turned away?
Unfortunately, sometimes yes. Sometimes yes. If people say they're from Scarborough, but really they're from London, Ontario, or if they say they're 52, but they're really 25, yes, we do, because this is a very scarce resource, and we really have to make sure that it gets to eligible populations and high-risk populations first. So the eligibility is in place for a reason. So if the information provided in the booking system was false, it is possible that people could be turned away, and we have done that.
Thank you. So another question we just got is, if I'm booked to show up and AstraZeneca, which currently appears to not be recommended for females under 55, is available, do I get a choice? Can you also clarify whether or not this recommendation is in effect for only over 55? So I think they're asking if the AstraZeneca is being supplied that day in the clinic, but they're not eligible to get it. Would they have a choice to get something else?
Well, I know we haven't had AstraZeneca in any of our clinics, but just in principle, the same question could have been Pfizer. And so typically, no, we have to administer what's available. And yeah, so if you come to the clinic and we are providing Pfizer, I don't believe there's the opportunity to say, no, I want Moderna. It has to be what's available that day. And similarly, if you went to a pharmacy and they were giving AstraZeneca, that's all they have. They wouldn't be able to give you Pfizer or Moderna. But people do have to sign consent, and at the time of signing consent, you are informed of exactly what vaccine you're receiving. So it's an informed consent, and if folks aren't comfortable with what they're to be given, then they don't need to stay. They don't need to sign the consent. And this is a good place for Dr. Bedri to jump back in with your very important reminder. Get whatever vaccine is available, right? You've said that a few times. Yeah.
Yes, it is very important. I can't stress enough how important it is to get the vaccine. We are in a very bad shape and we are in trouble. We are in trouble. The hospitals are filling up. Kids Hospital is accepting adults ICU patients. This just shows you how bad the situation is. And other hospitals, GTA hospitals, are transferring their pediatric patients to Kids Hospital and opening up beds for adult patients in the hospital. Hospitals are filling up. The only way we can avert the fourth or fifth wave is if we just get out and get the vaccine that's available or provided to us.
Thank you. So it looks like we have a live question from Donna. You can go ahead and unmute yourself and.
Thank you very much. And thank you all for the information. This has helped clarify a few things. I have one question. Is there one definitive website for Scarborough residents that we can use that will regularly update any new Scarborough hub clinics like the one at Brimley and Eglinton for 18 and over? Because from what I've understood, my son is not 50 or 55 and over, so we can't go to Centenary or Centennial College or Scarborough Town Center. It has to be one of these pop-up or the hub that's at Brimley and Eglinton. But where would we ever find them?
The best source of information, Donna, is the website Scarb Vaccine. Yeah, I put it in the chat and we try to update that as often as possible.
Yeah, because as of today, I guess the only one that's there is the Brimley and Eglinton one that's within that site.
The only one for the 18 plus.
Yes.
There's five sites listed on that page right now.
And as long as you live in the postal code of one of the priority areas, you can keep going there and trying to book, correct?
That's correct. And I'm sorry that the spots are filled. It does take a little while, but be patient.
Yeah, I booked for about 4 other people who have had difficulty, and I just keep going back. And even within the same day, a place will come up sometimes, but you just can't be a working person to do that.
Yeah, I know what you mean.
So I'm trying to help a few people, but can I ask the question why you're accepting everybody in Scarborough when Thorncliffe and Flemington Park are only taking 2 postal codes?
The reason is that the province did an analysis of postal codes, and there are 17 postal code areas in Scarborough. You know, Scarborough, you can recognize us because we're M1.
Yes.
So postal code with M1, you know, it's Scarborough. And of all of the 17 M1s that we have,
you're the only one that opened.
16 of them met the definition of high risk or hotspot community. So 16 out of 17. So we're basically saying that's pretty much all of Scarborough.
It seemed like
the reason why. But then there are other regions where they might, you know, a smaller proportion of their postal codes were considered high risk. but almost every single postal code in Scarborough is considered a high-risk hotspot community. So that's why.
Okay, thank you very much.
You're welcome.
So another question I see in the chat box is, when does the website refresh with new appointments?
I believe you can book up to 2 weeks in advance. So I think the process is every day you get added another day. So if today is April 12th, right now you should be able to book for the next 14 days, which goes to the 26th, and then tomorrow it will change to the 27th, and so on.
That's correct. And there has been a bit more variability just at the Brimley and Eglinton because we've just launched. So as we were ramping up, we've been able to open up more appointments. But now that we have our hours set and we know that as of Saturday, we'll be onto our what we call our regular full-time hours, it won't fluctuate as much. It will be, you know, every day for that 2-week period out that we'll be able to book appointments. So it's been a bit more volatile just because we've been ramping up, and as we've had greater access and hours, we've been able to increase and provide some more appointment times.
Thank you. Again, if anyone has any questions, you can just raise your hand or unmute yourself.
What I can add while people are thinking too is that when you do get to one of the vaccine locations, I can rest assured, and as Michelle said, there's an informed consent process. So there's also opportunity there to have questions answered and an opportunity to talk with the clinical staff so that it can really, again, contribute to building that confidence, and any questions that you may have, you'll have that opportunity to talk to the team.
I see Donna has her hand up again. You can just go ahead and unmute yourself.
Sorry. Do you wait your 15 minutes after your vaccine inside at that location at Brimley and Eglinton? Is any of it outdoors?
No, you may have to wait outdoors a little bit to come in, but once you're in, registered and screened and get your vaccine, the observation area is inside the building for sure.
And will people be spaced 6 feet apart waiting?
Yes. One of the reasons we were able to choose that location is that we relocated other services so that we were able to make sure that appropriate spacing and all the appropriate infection prevention control measures are in place. So you'll see the staff appropriately masked and face shields, and you'll also, everyone coming in has to wear a medical mask as well. So all the appropriate precautions remain in place. Great question. Thank you, Donna.
Thank you, because that's important. Thank you very much.
No, thank you for the question.
I'm just going through the chat box to see if there is anything we may have missed. So I think it doesn't look like there are any more questions for the time being. So I just want to give a big thank you to all of our panelists and speakers for today. I would now like to invite Ginny, who is already here, to provide a few closing words.
Thanks so much. And then thank you all for participating, for your great questions. I don't have much to ask. We've had some wonderful commentary and experts that have been able to answer so many of the questions that we have. I think in the chat we can also share, if you have further questions, the contact information. To echo our colleagues, Dr. Bedrine Belha, please just get vaccinated. If you have questions, there's lots of resources that we can help you provide the answers and give you that comfort. But the sooner we all are able to get vaccinated, the sooner we'll all be able to enjoy life in a different standard again. So I really appreciate the time that our guest speakers took today to come and share their personal stories and stories of their efforts of getting vaccinated and those experiences, and also are answering questions specifically related to the different vaccines and the experience itself. So thank you very much, everybody, for coming out this evening. And thanks to Deborah and her team for doing a fabulous job in coordinating and organizing our town hall again, and look forward to another opportunity, hopefully in the near future, to also reach out again. Thanks, everybody, and have a good